A pleasant study time to everyone. I hope everyone's doing great and excited with the upcoming full blast face to face classes. I am Sir Roy, by the way, and I am your clinical instructor for today. So, today I will be delivering our supposedly first face to face lesson on laboratory safety and regulations. However, due to the suspension order, I will be delivering this pre recorded presentation instead. So after the presentation, you are expected to understand the regulatory frameworks that govern laboratory safety, identify and recognize potential hazards inside the laboratory, learn about the safety program and personal safety measures, and learn and recognize the proper use and importance of personal protective equipments and safety equipments. Working inside the laboratory poses almost all forms of risks for the medical technologies. And since a laboratory houses variety of potential dangers or hazards, such as, okay, for example, chemicals, especially for example, when under clinical chemistry section, biological agents in general, which can cause infections and mechanical hazards due to equipment. By understanding class the principles of laboratory safety, individuals can work more effectively and efficiently while ensuring and promoting a safe working culture and environment. So, class, when we say laboratory safety, it is not just a process but a careful process that basically aims to prevent the occurrence of injuries and diseases inflicting among students, laboratory staff, or medical technologies, and for the patients as well. And take note, class, that safety begins with the recognition of hazards and is achieved through the application of number one is and will always be common sense. Why? Okay, there are several factors that actually justifies it. So, for example, understanding the risks. Common sense dictates that anyone working in a laboratory should be aware of the potential risks that are associated with the, for example, reagents and chemicals as well as equipments they are handling or we are handling. Also, when following procedures, common sense dictates that all laboratory procedures should be strictly be followed to prevent erroneous results, right? And also wearing of appropriate protective equipments. Common sense dictates that protective equipments should be worn at all times for protection against reagent spills and other laboratory hazards. So what else? When keeping the work area clean. So, common sense dictates that a clean and organized working area will prevent accidents and it will make it a lot easier to identify and correct any potential hazards. So, everything, including safety focused attitude, a good personal behavior, well, of course, good housekeeping, which I already have mentioned earlier, and good laboratory technique all are intertwined under the application of common sense. Standard precaution states that all human blood and other body fluids are treated as potentially infectious for HIV and other blood-borne microorganisms that can cause infection in human. And your standard precaution class is actually a set of guidelines that was developed by the Centers for Disease Control and Prevention, or CDC, which generally aims to prevent the spread of infection from patients to healthcare workers and vice versa. So, from the statement class, it means that the main concept of the standard precaution is actually based on the assumption that all patients' samples are potentially infectious and require the same level of care regardless of the diagnosis or suspected infection status. While universal precaution states that all patients are assumed to be possible carriers of blood-borne pathogen. So, universal precaution is actually an older set of guidelines developed by the same non-government organization, which is the CDC, in the 1980s to prevent the spread of blood-borne pathogens such as your HIV and hepatitis B virus infection in the healthcare setting. So the concept was generally based on the assumption that all patients were potentially infectious with blood-borne pathogens. So, okay, class, the main difference between these two is that the standard precautions include additional infection control measures beyond those required for blood-borne pathogens, such as respiratory hygiene and cough etiquette, also safe injection practices, and proper handling and disposal of sharps and contaminated items or materials. What else? It also emphasizes the importance of hand hygiene as the most effective way to prevent the spread of infection. And above all, class, take note that while the universal precautions were once the standard for infection control in the healthcare setting, they have been replaced by standard precautions, which basically provides a more comprehensive approach in the infection control. The Occupational Safety and Health Administration, or OSHA, is a federal agency in the United States that is mainly responsible for ensuring the safety and health of workers in the workplace. So, our OSHA office here in the Philippines is situated at Agham Road, Quezon City, Metro Manila. So OSHA or OSHA was established in 1970 under the Occupational Safety and Health Act, and its primary mission is to prevent work-related injuries, illnesses, and mortalities by setting and enforcing standards, providing training and education, and conducting outreach activities. Also, um, the hazardous communication programs, which is also known as the Right to Know standard, ensures that the chemical hazards in the workplace are identified and the information concerning these hazards is communicated well to the employers and to employees. The Centers for Disease Control and Prevention, or CDC, is a national public health agency that originated in the United States. Actually, class, the main base or headquarters of CDC is at Atlanta, Georgia, and its primary function is to protect public health and safety by promoting disease prevention as well as injury prevention and control of infectious diseases. So the important programs under the Centers for Disease Control and Prevention includes, well, of course, your disease surveillance and investigation. They also pioneers on the immunization and vaccine programs. What else? Health promotion and education, and of course, the very famous laboratory research. So our CDC office in the Philippines is headed by Dr. Romel Lacson. In 2006, CDC have introduced the National Healthcare Safety Network, or NHSN, which is a voluntary system that integrates a number of surveillance systems and provides data on devices, patients, and staff. One famous example is the physical layout of proper hand washing, and take note, class, that CDC, as we all know, has one main goal, and that is to prevent the spread of pathogens. Next, we have the Joint Commission. So the Joint Commission class was founded in 1951 and has been a leading accreditation body for healthcare organizations in the United States. The Joint Commission class is an independent and a nonprofit organization that was formerly known as the Joint Commission on Accreditation of Healthcare Organizations, or GCAHO. And the main function of this organization class involves a comprehensive evaluation of a healthcare organization's policies, including procedures and practices, and includes an on-site surveys. So, the most important thing to know about Joint Commission class, This also issues standards and grants accreditation to improve the safety and quality of care provided to the public through inspections of healthcare facilities. Moving on with CAP, or College of American Pathologists. So it is a member-based physician organization that was founded in 1946, which is actually a professional medical organization based in the United States as well, that represents approximately 18,000 board-certified pathologists and serves as a leading authority on laboratory quality assurance and as well as patient safety. And almost similar to the other organizations class, CAP issues standards and offers accreditation through facility inspections. But ultimately, the College of American Pathologists plays a critical role in advancing the practice of pathology and laboratory medicine, and in ensuring that patients receive accurate and timely diagnostic testing and treatments. Next, we have our very own Kagawaran ng Kalusugan, or the Department of Health. So it holds the overall technical authority on health, as it is a national health policymaker and the regulatory institution in the Philippines. And aside from that class, it developed national plans, technical standards, and guidelines on health. So most importantly, class, DOH oversees the regulation of healthcare providers and facilities in the Philippines, which includes the licensure and accreditation of healthcare professionals, as well as licensing and inspection of hospitals and other healthcare facilities in order to ensure that these facilities meet the required standards for safety and quality. So in terms of the inspection naman, class, with consultants to the Republic Act 4688 of the Administrative Order 59 Series of 2001, or otherwise known as your laboratory law, states that all clinical laboratories must be inspected every 2 years or as necessary. So most of the time, class, DOH visit and inspection is unannounced. So that is the very reason why it is very imperative to make it a habit to perform all necessary procedures and make sure to gather and accomplish all requirements for the inspection, so that whenever DOH comes for a visit, everything is ready, and this will also prevent being penalized or sanctioned. So next we have CLSI, ISO, and the WHO. CLSI stands for Clinical Laboratory Standards Institute, which is also a global standard nonprofit institute that develops standards and guidelines for clinical laboratory testing and healthcare practice. So the main role of this institution class is to promote and improve the healthcare system by developing and publishing consensus-based standards and guidelines for medical laboratory testing and clinical practice. Next, we have ISO, which stands for International Organization for Standardization, which is also a global nonprofit organization that develops and publishes international standards for a variety of industries, which, well, of course, includes healthcare services. And okay, this standards class under your ISO provide guidance and best practices for healthcare organizations, and generally, it helps to improve the quality and safety of the healthcare system and healthcare delivery. And lastly, we have the WHO, which is the World Health Organization, which that is responsible for international public health. So moving on with safety program. Accreditation organizations require clinical laboratories to have a formal safety program, and that the program needs to ensure that the laboratory environment meets the approved safety standards. So, a safety officer or chair of the safety committee is accountable in implementing and maintaining a safety program for the healthcare facility and the delivery of healthcare services, while a chemical hygiene officer or CHO has the responsibility to provide technical guidance in the development and implementation of the chemical hygiene plan within the healthcare facility. Next, we have material safety data sheet. So it defines the toxicity of the chemical. You can see this written or labeled in every reagent or chemicals that we utilize inside the laboratory. So the MSDS must be provided by the manufacturer and includes the following information. We have the physical data. So what are the physical data that we are referring to? They are the boiling point, the vapor pressure, and the specific gravity. And okay, next B is the threshold limit value. So when we say threshold limit value, we are referring to the exposure allowable for an employee during 1 8 hour duty or day. So that is threshold limit value. Letter C, spill disposal and first aid procedures. And the MSDS must also include the personal protective equipment required to handle the chemical. And lastly, um, additional toxicity must be listed. This would include identifying the chemical as carcinogen, mutagen, or teratogen. So when we say carcinogens, of course, these are agents that can cause cancer. When we say mutagen, these are agents that can cause alteration of the DNA, cellular DNA composition. And when we say teratogen or teratogenic, these are agents that can impair the physiologic development of the fetus. Okay, the laboratory should have a safety committee or an inspection team that inspects the laboratory in a periodic basis. Several federal, state, and private accreditation organizations, such as the one mentioned earlier, College of American Pathologists, and TJC, they conduct inspections of healthcare facilities, and these inspections may be regularly scheduled or unannounced, and also inspections may also follow a complaint filed against the facility whenever the facility failed to meet the requirements necessary for the inspection or accreditation. So next is a very basic factors that everyone must be aware about. So listed here in this particular slide are quite objective and easy to apprehend. So number one, we under personal safety, wash hands before leaving the laboratory and after taking off gloves. And of course, do not pipette by mouth, tie back long hair, and avoid loose sleeves or cuffs, rings, bracelets, and etc. Do not apply cosmetics in the laboratory. And most importantly, everyone must know this, class. Number five, eating and drinking are forbidden inside the laboratory. And number six, for your personal safety, we should possess or perform, at least perform good housekeeping attitudes or behavior. So housekeeping, by maintaining orderly work areas, keeping aisleways clear and free of tripping hazards, and keeping floors dry to avoid slipping, and attend to spills immediately. Okay, the OSHA requires that employers provide all necessary personal protective equipments to his or her employees. So we have here eye protection, protective clothing, and hand protection. So your eye protection class are your goggles and face shields. Your protective clothing includes your laboratory coat and foot protection. So your laboratory coat, as we all know, is designed to protect the clothing and your skin from chemicals that may be spilled or splashed during the duty. So it should be worn buttoned up and with the sleeves extended to the wearer's wrist. That is the required type of laboratory coat. So sa footwear protection naman, this is designed to, of course, prevent injury from corrosive chemicals or heavy objects. So if a corrosive chemical or heavy object were to fall on the floor, the most vulnerable portion of the body would be the feet, right? So for this reason, shoes that completely cover and protect the foot are worn inside the laboratory. So next we have hand protection. So heat resistant gloves. Um, we are using heat resistant gloves when handling hot or cold objects, and latex or nitrile gloves to prevent your the exposure to biological hazards. Okay, next, personal protective equipments. So I repeat, OSHA requires that employers provide all necessary personal protective equipment or PPE to his or her employees. So what are these PPEs that the OSHA is referring to? So for eye protection, we have goggles and face shields. Protective clothing, we have laboratory coat and foot protection, and your hand protection, heat resistant gloves or latex or nitrile gloves. Moving on with safety equipment. So number one is individual storage containers. So selecting the best means of storage for chemical reagents will depend mainly on the reagent's compatibility with the container. So a safety can is an approved container of no more than 5 gallon capacity, and it has a spring closing lid and a spout cover, and is designed to safely relieve the pressure buildup within the container. And for sharp containers, we use hard containers for the disposal of sharp objects such as used phlebotomy needles, broken contaminated glass slides and glass tubes and pipettes. So one best example would have to be the used Zonrox bottle. Okay, number two, eye wash stations. They must be inspected and tested periodically for proper function. Number three is safety showers like the one we have at room 216. It provides an effective means of treatment in the event that chemicals or reagents are spilled or splashed onto the skin or clothing. Okay, next, refrigerators and alarms. Take note, class, that the standard refrigeration temperature are not appropriate for storing flammable materials, and they are not also appropriate for storing food for consumption. So each refrigerator must be labeled no food or beverages may be stored in this refrigerator. And also, this applies for laboratory freezers as well. Number five is alarm. They are designed so that the endangered personnel is alerted in case of emergency. And take note that all individuals should become familiar with the exact location of the fire alarm and fire stations nearest to the laboratory. Okay, number six, chemical spills. Laboratories are actually equipped with cleanup kits for various types of spills in anticipation and for prevention of further harm for the laboratory staff. So, and that's exactly why, class, it is very much an imperative also to wear the appropriate PPE when working inside the laboratory and dealing with spills such as chemical spills And okay, class, the immediate action for acid spills is to neutralize the spill with neutralizing agents such as sodium bicarbonate, or what they call that, uh, calcium carbonate, and make sure to contain the spill with absorbent materials such as sand, or what's that again, vermiculite. And after disposing the waste in the hazardous bin, make sure that make sure and do not forget to rinse the affected area with water. So as for solvent spills naman, class, before anything else, we need to shut off any ignition sources and turn off electrical equipment near the solvent spill, and apply activated charcoal to the perimeter of the spill. And same as for the acid spill, class, we can contain the spill with absorbent materials such as sand or vermiculite. After disposing the waste, make sure to ventilate the area to remove any fumes or traces of vapors from the solvent spill. Okay, this class um, is how we deal with spills in an actual laboratory setting. Okay, chemical fume hood is a partially enclosed ventilated workspace for volatile chemicals, and the only safe place to work with some highly toxic and volatile chemicals. This is generally ducted and vent air outside the building, so functioning like an exhaust air system. And take note, class, that fume hoods are not to be used for storage of hazardous chemicals. Okay, waste collection and disposal. Discard all non-sharp biohazardous substances into the biohazard bags, and dispose of used tubes in biohazard bags. Dispose of swab wrappings and band-aid wrappings. Use paper towels, kit boxes, and any other non-biohazardous waste into the red biohazard bags. And lastly, that is included under your waste collection and disposal. Store chemicals in appropriate chemical can, and chemicals should not be poured down the sink drains. So take note of that. They shouldn't be poured down the sink drains. Next, we have laboratory hazards. So for the rest of the succeeding slides, class will be more of a review already of the basic concepts about laboratory hazards, since I believe that it has been introduced and discussed to you several times on your earlier years. Okay, the United Nations has actually categorized different potential hazards into 9 classes or classifications. So as for class 1 hazard, it consists of explosives that have a mass explosion hazard. Examples under class 1, we have black powder, nitroglycerin, and mercury fulminate. Class 2, we have compressed gases, and these are gases that have been compressed to a high pressure and stored in gas cylinders or tanks. Examples of compressed gases include oxygen, nitrogen, what else? Carbon dioxide, argon, helium, propane, and acetylene. So class 3, we have examples for class 3, flammable liquids, kerosene, ethanol, methanol, acetone, toluene, and others to name a few. Class 4, we have examples of flammable solids include certain metallic hydrides, metallic sodium and potassium. Also, oily fabrics, processed metals, including your matches and nitrocellulose products. Class 5, we have the oxidizer materials, and examples of these oxidizer materials include hydrogen peroxides. We also have potassium permanganate, nitric acids, sodium chlorate, and chlorine. Class 6, we have toxic chemicals like mercury, lead, cadmium, arsenic, benzene, the one we use often in histopath, formaldehyde, and many others. Class 7, we have radioactive materials like technetium 99M, iodine 131, cobalt 60, and a few more examples. So class 8, we have corrosive chemicals like hydrochloric acid or HCl, nitric acid, also potassium hydroxide and ammonium hydroxides. So lastly, class 9, we have miscellaneous materials that are not classified elsewhere. So examples of class 9, we have dry ice, lithium batteries, and your aerosols, of course. And dry ice class, when you say dry ice, this is actually a solid carbon dioxide that is used as a refrigerant and can cause frostbite if it comes in contact with the skin. When we say lithium batteries, these are rechargeable and non-rechargeable batteries that contain lithium and which can catch fire if they are damaged or short-circuited. Aerosols, we have pressurized containers that can release their contents as a mist or spray and can be flammable, toxic, or corrosive. Next, we have warning labels. The NFPA, or the National Fire Protection Association, is again an example of a nonprofit organization that aims to reduce the risk of fire and other hazards. So, the development of fire safety codes and standards, as well as education, research, and advocacy. So, the National Fire Protection Association develops and publishes more than 300 consensus codes and standards that are designed to minimize the risk of fire, electrical hazards, and other dangers in various settings. So we have here a nice illustration of the hazardous materials classification, or the diamond hazard symbol, which is divided into four quadrants, each containing a different color and a symbol. So the blue quadrant indicates the level of health hazard associated with the substance, ranging from 0 to 4, which is least hazardous to most hazardous, respectively. The red quadrant indicates flammability, ranging from 0 to 4, meaning no hazard to extreme flammability, respectively. The yellow quadrant indicates the level of reactivity, which ranges from 0 to 4, which means as 0, no reaction, to 4, which is reacts violently. And lastly, the white quadrant is used to indicate special hazards such as oxidizers or water reactive substances. This NFPA class, particularly the symbol, is commonly found on containers of hazardous chemicals. And take note, class, and I want you to remember that this symbol is not a substitute for proper handling and storage of hazardous materials. It is always important to follow proper safety protocols when working with potentially dangerous substances to, well, of course, minimize the risk of accidents and injuries when you are performing your duties inside the laboratory. So as for chemical hazards, approved spill kits must be nearby the workstation or the working area. It is also imperative, class, to always label all containers before adding the chemical. And some chemicals also, class, can become more hazardous if stored for a prolonged period of time. One example is the picric acid. And when this picric acid is stored for a very long period of time, it has the tendency or the potential to become peroxides and become shock sensitive that can cause explosions. We also have sodium azide, which is carcinogenic in nature, is sometimes used as a preservative in laboratory reagents. When disposed in dissolver, the accumulation of copper and iron salts will become mechanical shock sensitive agents that can trigger an explosion. So it is important to always read the labels of the reagents as to, and also the proper protocol and procedures of the laboratory when disposing this kind of chemicals or agents. So working with carcinogens requires special precautions, as I was saying, such as using fume hood, wearing rubber gloves and a respirator, and cleaning contaminated glassware with a strong acid or organic solvent. Chemical containers made of glass should be transported in rubber or plastic holders that will insulate them from breakage or protect them from breakage. Okay, next we have fire hazards. Flammability is defined as a measure of how easily a gas, liquid, or solid will ignite and how quickly the flame will spread. So do not get confused with these two technical terms. Flammable and inflammable both means to catch fire easily. And take note, class, that flammable liquids themselves are not flammable, rather, the vapors from the liquids are combustible. So we have two physical properties that indicate flammability. We have the flash point and the volatility. When we say flash point, this is the temperature at which a liquid or a volatile solid gives off vapor in quantity significant enough to form an ignitable mixture with air. So we have different flash points for flammables and combustibles. So when the flash point for flammables is less than 100 degrees Fahrenheit, for combustibles greater than 100 degrees Fahrenheit. So number two, we have volatility. This is an indication of how easily the liquid or solid will pass into the vapor stage, and this is measured by the boiling point of the material. So next, these are a few and additional pointers under your fire hazards. Xylene, ethanol, methanol, and acetone are flammable liquids or chemicals that are commonly used inside the clinical laboratories that must be stored in a flammable liquid safety cabinet. So some materials are pyrophoric, meaning that they can ignite spontaneously with no external source of ignition. One example is your potassium metal that can react with the moisture in the air. So also on the storage naman, flammable materials should never be stored near the acids, and storage areas should be cool enough to prevent ignition in the event that vapors mix with the air. Adequate ventilation should also be provided to prevent vapor buildup. And lastly, be aware of ignition sources in your laboratory area, such as heat and electrical sources. Okay, for the handling of fire hazards, we need to use gloves and safety goggles. And dispensing of flammables and combustibles should only be performed in a fume hood or in an approved storage room. And we also must remember to not use water to clean up flammable liquid spills. Okay, we have extinguishers classifications that are according to a particular fire type. So classes, we have type A, B, C, and D. Okay, presented here in this particular slide, the characteristics of each of the fire extinguisher classes. I mean, fire type classes. So for type A, these are combustibles that includes wood, cloth, paper, rubber, and plastics. Type B includes flammable liquids such as oil, grease, and paint thinners. Type C, we have energized electrical equipment like electrophoresis. And type D, combustible materials such as magnesium, titanium, sodium, lithium, and potassium. So, multi-purpose extinguishers are highly recommended because they are effective against types A, B, and C fires. Okay, we have biological hazards. So, since we are dealing with the clinical chemistry section of the laboratory, these biological hazards are actually not much of importance, especially the biosafety levels. However, I am going to present to you the different classes and the role of the National Institutes of Health guidelines. So the NIH guidelines categorizes four levels of biosafety depending on the biological agents that are isolated or studied. So the levels are based on the virulence of the agents and the availability of effective treatments and vaccines. So for biosafety level 1, they handle agents that have no known potential for infecting healthy people. Biosafety level 2 works with microorganisms that are associated with human diseases that are rarely serious, and for which preventive or therapeutic interventions are often available. Biosafety level 3 recommended for or is recommended for materials that may contain viruses that not normally encountered in a clinical laboratory setting. It also includes cultivation of mycobacteria. Biosafety level 4 works with dangerous and exotic agents that pose a high risk aerosol transmission, transmitted laboratory infections, and life threatening diseases for which effective treatments are limited. One example is the COVID-19 infection. Okay, that is the end of our presentation. If you have further questions, so you can reach me through my messenger account. So that would be all for today. Thank you and have a nice day.